Hi guys, my name is Caitlin. This is the Grass-Fed Girl. We're here today with my friend Nevada Gray. She is a pharmacist from Massachusetts, and she's going to be sharing her amazing story of recovery and healing with a carnivore diet and a keto diet. So we're so happy to have you here, Nevada. Welcome.
Thank you so much, Kaylee. It's a pleasure.
Awesome. Well, I've heard you on a couple of podcasts, and I know a little bit about your story, but people may not be familiar. So why don't you just tell us a little bit about, what got you into this and a little bit about your journey?
Sure. So I've always had polycystic ovarian syndrome my entire life, which was kind of the bane of my existence and what catapulted me into healthcare. Eventually was to just try to fix this situation that I was in. I was gaining weight. I had a diagnosis of prediabetes and was just really struggling with this condition. So I started out going to the gym, following the standard American diet, eventually transitioning into a paleo diet and implementing what I was learning along the way while I was in nursing school and studying biochemistry and then studying pharmacy. And long story short, at the at my pharmacy graduation, I was my heaviest weight I had ever been. I was around 220 pounds. Sort of a short person. I'm just under 5'4". So carrying around that weight was hard. And I was also working in healthcare. So I was advising people on lifestyle changes and speaking to my patients every day. And here, I was 220 pounds and I couldn't figure it out for myself. So I was really, really struggling. So when I graduated school, I had a prediabetes diagnosis. I had my physician say, well, why don't you try a low carb diet? And that's pretty much the only guidance that I was given. So I transitioned into a paleo diet, started training at the gym. I had containers in my refrigerator. It was jam-packed with meal prep. I was eating every 2 hours. I was killing myself at the gym. I was able to lose 50 pounds, which was a very hard 50 pounds to lose.
So about what year was that?
That was around 2013, 2014, somewhere in there. And while I was implementing this lifestyle, I was proud of the 50 pounds I was able to lose, but I wasn't losing any more weight, and I still was not feeling very well. I was tired. I was starting to feel a little depressed and down, and I started just not feeling good one day. I developed a headache. I developed swollen glands, a fever. And I went into a local emergency room because I was worried that I may have meningitis because that's how bad I felt. And my neck, I had never had pain like that in my neck before. I never had a headache like that before. So they did a spinal tap and a CAT scan. And when they did the spinal tap, I developed a leak where the dura tore. Where they did the tap, and I developed a cerebral spinal fluid leak that required a blood patch. And after that procedure, I ended up having severe back pain for about a year and a half, 2 years, and unrelenting headaches. I was given a diagnosis of mono, which is what had caused my headache and my swollen glands. So I was struggling with back pain. I went into physical therapy. I continued to work out at the gym, follow the paleo diet, lost a little more weight. And then one morning, I woke up essentially paralyzed from the waist down after developing severe sciatica the previous day. And I went to get out of bed that morning, and this was the worst back pain I had ever felt in my life. My legs were not working. I ended up falling. I was incontinent of my bladder. And I realized that there was something drastically wrong, and I had to get to a high-level medical center at this point. So I started calling everybody in my telephone, and I had a friend come and get me and take me to the nearest highest level medical center that was in my area, which was about 25 minutes away. The paramedics had to get me out of the car because I could not walk at this point. I was having trouble feeling from my waist down. I had saddle anesthesia. I had bladder incontinence. My feet were not moving up and down. It was as if my entire lower half of my body was asleep and lathered in Bengay is the only way to describe how it felt. And it was the most excruciating pain I had ever felt in my life. So they immediately recognized there was something wrong with my spinal cord. So I was rushed into an emergency MRI where they noticed that I had a either massive disc herniation or tumor. They weren't quite sure that was a disc herniation. So I was urgently transported to another higher level medical center where they determined it was a disc. It was my L5-S1 disc that had herniated centrally. So the annulus that holds the disc in place had ripped from side to side, and the whole disc just exploded in my back, and it crushed the horsetail of the spinal cord, which is called the quada equina, and that's responsible for all your bowel and bladder function, for your muscle movement and tone and reflexes and sensory from the waist down. So I had lost all reflexes. I was unable to move my feet. I was unable to feel anything. And I could feel myself becoming more and more paralyzed as the time was going on, just from the time I woke up to the time I was brought into surgery. So they performed a microdiscectomy and decompressed all of the disc material that was off of the nerves on the quada equina. My neurosurgeon delicately picked everything off, everything he could get to. And from there, I had the most excruciating 24 hours of my life where I was unsure what my future was going to hold, whether I was going to be able to walk again, what was going to happen. It was just a time of uncertainty, extreme anxiety on my part. I couldn't sleep the entire night. And I was also my roommate who had a stroke, who was in the same room with me. We ended up listening to a sermon by T.D. Jakes called Nothing Just Happens on replay for that entire night, because both of us were unsure of our future. And then the next morning I got up and I was able to take a few steps with a walker, but I was extremely weak in my muscles from my waist down. And I was hospitalized for about a week, waiting for my bladder to come back, which it did, thank God. And I was able to get myself discharged home with services, with physical therapist, aide, nurse, and basically needed somebody with me at all times because I was unable to get up and walk to the bathroom. I was unable to shower by myself. Everything that you take for granted, because I was just so weak.
Were you starting, did you have problems going to the bathroom and stuff?
I did prior to the disc herniating, which was a red flag that something could be wrong with your spinal cord. When you have back pain, there are certain red flags to watch for that can are red flags for the Equada Spina Syndrome, which is what I was diagnosed with. And what that is you start to have saddle anesthesia. You start to have trouble going to the bathroom. A lot of people start having problems with their bladder, because what happened in my case was I lost the sensation of knowing that I had to go. So my bladder was filling to capacity, and I couldn't feel that it was full, so it was just overflowing once the bladder filled to capacity. And that happens in a lot of cases. You just don't realize that you have to go because you're starting to lose sensation. And when that happens, I've been asked, well, how could you not know that you were having these problems? And I noticed I was just having some problems going to the bathroom, that I was having urinary retention. But when you're starting to go paralyzed, you lose the awareness of it because you just don't have the sensation. So the brain doesn't connect to that. And until something catastrophic happens, when you start really having trouble moving your legs, and it becomes noticeable to you that it's kind of progressed to the point where you're nearing the time where you're going to need that emergency surgery. So some of the red flags are severe back pain, saddle anesthesia, trouble with bowel and bladder.
Anesthesia?
Yes. So the saddle anesthesia is basically if you sit on a horse, the area where you're sitting on a horse becomes numb, and you lose all sensation in that area, in your inner thighs.
Sounds like something a man would come up with.
Yeah, it's a red flag. If you start having that and you're having back pain, it's a red flag that there's compression to the quada equina that requires an urgent workup.
So do you think this was like a medical injury?
Yeah, it was. I feel like how I became injured and how my disc herniated was I was not moving properly. I had malnourished movement. In reading the work of Stuart McGill, I realized I had repetitive movement that didn't have the best posture. I was training in the gym and I didn't have the core strength to support my lumbar spine to be doing some of the exercises that I was doing, and I was doing them repetitively. The spinal tap, which I believe injured the annulus of the L5S1, and it had trouble healing because of the malnourished movement that I had. And in hindsight now, I believe that my diet played a role. I just recently read a paper sent to me by Sally Norton on spinal discs that actually had oxalate crystals in patients that had surgery for herniated discs. And I thought, when I looked back on my diet, when I was eating a high oxalate diet because I thought these were nutritious foods at the time. So I was eating a high oxalate diet, even though I believed I was eating, a healthy, nutritious diet. I was following the paleo diet.
Like spinach and stuff like that?
Yes, I was eating a lot of spinach. I was eating a lot of berries. I love Swiss chard. I was putting this in salads. At one point, I was doing, and I don't want to name the company, but I was doing a shake smoothie as part of my paleo diet that was very high oxalate. So I believe a combination of all of this in hindsight contributed to my disc herniation. Wow. That almost paralyzed me.
And you had been besides being overweight, you had been pretty healthy up to that point, right?
Yes. I didn't have a lot of medical problems. I consider myself just an average person, average woman that was struggling with PCOS, just trying to figure it out as far as what should I be eating, how should I be training, how can I fix this situation. So I was just the average American woman.
You didn't have like chronic back problems before that or something?
No. I didn't have back problems until the spinal tap happened. And after that, I had unrelenting back pain and headaches, which I had never had before. I had a daily headache, and I had unrelenting back pain that I was in physical therapy for. I was, trying to do everything to correct it.
So tell us a little more about the recovery process.
So the recovery process was one of the hardest things that I ever went through in my life. And what essentially happened was I was discharged home with services, and I was extremely weak from my waist down. I had foot drop in my right foot. My right
like flops around.
Yes. So the injury to my the quada equina was not allowing me to move my right foot up and down. So it would drag. It's kind of very lazy. My right leg was more severely affected than my left as far as sensory and motor. So I had to swing my leg, and then it would just slap down. It was exhausting just to be able to walk, because it took so much energy, because my leg felt so heavy. And then it was challenging to walk with the walker, because I had to use several devices to be able to walk, because the walker was in the way for the way that I had to move my leg over to slap it down. So I started working with a physical therapist immediately. They put me on a rehabilitation program in the home that started working on correcting muscle imbalances. And then eventually I was discharged from the home services, and I was able to go to outpatient physical therapy, where I found a physical therapist that worked with me to help correct the muscle imbalances and get back a normal gait. And how this all started was I had my rock bottom day. And I think everyone that goes through something catastrophic like this has that rock bottom. And I called a friend, and I told her, I'm like, I don't know how I'm going to do this. I don't know how I'm going to get through this. I don't know what my future is going to hold. I essentially cannot walk. I'm a paralyzed person. And she said, well, why don't you go on YouTube and find people that beat the odds and watch these videos to inspire yourself and get yourself motivated. Because I had Googled my condition as well, which my neurosurgeon told me not to Google. And it was one of the worst things I could have done, because Equada Spina Syndrome is a rare condition. It's around 1 in 100,000. And there was one paper I read that was 1 in 2 million. A lot of patients, because it's not caught in time and they do not have the emergency surgery required to save their Equada Spina, have permanent paralysis. They have chronic pain. They have bowel bladder incontinence and are essentially disabled. So I was reading this, and then I was on the Equada Spina feeds, reading stories, and I just thought, how am I going to be able to recover from this? When patients are not recovering. So I called my neurosurgeon. He said, he had told me, he's like, I believe you can have full recovery. It's going to be the hardest thing that you've ever done, but I believe it's possible. And he said, do not Google your condition, and, stay off of social media about it, and just do your best in the rehab. Focus on correcting your muscle imbalances. Keep yourself moving. So I ended up watching YouTube, being on PubMed, looking through the literature. There wasn't really a lot of literature. And I chanced upon a man called Sean Stevenson. And he corrected and cured his degenerative disc and spine disease with fitness and nutrition. So immediately I tried to find everything I could on this man. He wrote a book called Sleep Smarter. He had a podcast. I created an Instagram account just to get in touch with him. And he gave me some really good advice and directed me to his YouTube videos and his podcast where he talked about how he corrected his back. And part of it was just listening to your body, because it knows what to do. It knows how to heal itself. You just have to listen to its cues. So I thought, well, what is my body telling me? My body's telling me I'm exhausted. I want to sleep. My body's telling me I'm not really that hungry. And I started just craving proteins and fats, which were, it was a different type of craving for me based on how I had been eating prior to that. So I started doing some more research, focused on correcting the muscle imbalances, started implementing restorative sleep. So I put myself on a sleep hygiene program. I started drinking a lot of water, because the spinal discs they do not have a blood supply. So the only way the raw materials that you're eating to get there to heal themselves is actually through diffusion during restorative sleep. So hydration and restorative sleep were one of the 2 critical components to my recovery. And then I chanced upon some research regarding nerve regeneration in the ketogenic diet and how it was neuroprotective and motor protective. So I started researching this a little bit, and I found Vanessa Spina, who's the ketogenic girl, and I reached out to her over the internet, and I purchased her coaching program and her meal plan, and she helped me a lot. I reached out to her personally if she could help me, and she helped me formulate a correct ketogenic diet. And I immediately started noticing differences in my pain level. I started losing weight, which wasn't why I was doing this. I was doing this for the neuromotor protective aspects of it. And I noticed that I started to get a lot back in the first few months. So that was really encouraging. My gait,
a lot of movement.
Yes, a lot of strength. Some of the sensory and motor had returned, but because my Equada Spina was so swollen, I required some high dose steroids to be able to control the swelling in it from the disc injury. And I had, based on the nerve injury, it would be classified as an ischemic injury because it was compressed. It wasn't that the nerves were ripped apart or anything. It was just they were stunned. So in reading some of the papers, injured nerves have altered glucose metabolism. So by feeding your nerves an alternative fuel source can kind of be a workaround for that, for them to rewire if they have to, or kind of reset themselves and regenerate. So I got myself into a state of deep ketosis, and I focused on eating a higher fat component because I had read some papers in epilepsy that the patients that did the higher fat component got a better result. So I was basically extrapolating other neurological conditions to my condition because there was no literature. So I was looking to see, well, what is it showing about diabetic neuropathy? What is it showing about ALS? What is it showing about MS? What is it showing about epilepsy? Even though some of these conditions were in the central nervous system and my injury was in a peripheral nervous system, I thought, well, if it's helping a nerve, then it could potentially help the peripheral nerves that were damaged, because I knew peripheral nerves were more forgiving when they're damaged because they can regenerate as long as certain aspects of the nerve are still intact and certain aspects are not damaged. So I was very hopeful that those aspects of my nerves were intact. So I started doing the ketogenic diet. I followed it for about, I would say 8 months, 9 months. And then I noticed throughout the course of doing the keto diet that I craved protein. So when I would cheat on her program, I would be eating more protein. I wasn't really a fan of the keto desserts and stuff like that. So whenever I had a chance, we could substitute with a protein such as eggs. So I was always be substituting with a protein. And I was a ridiculous tracker. I always had to make sure I was in ketosis because I felt that my life depended on doing this diet correctly to get my motor and sensory back and my strength. So I started implementing the keto diet. I was correcting muscle imbalances. I was getting restorative sleep, and I was hydrating. And I did this like it was my religion. I created a whole schedule for myself. And I also had a mindset component because I discovered Dr. Joe Dispenza, who corrected, he had a back injury, a spinal cord injury, and he healed himself using the power of his mind and turning on his genes using epigenetics. And he's written several books on how to go about doing this. So I was also implementing that as part of my recovery too. And then throughout the course of that, I heard Sean Baker on Joe Rogan, which I'm sure everybody has at this point. And that's when I decided to go more into a carnivore diet based on that was about, I want to say maybe a year and a half. Because prior to that, I was a closet carnivore. I was eating a lot of protein and fats, and I would go long periods without a vegetable, and I'd be so socially conditioned. I was like, oh, I have to have a vegetable, so I'd have some spinach, or I would have
so you were still eating the
yes. So, or I would have a Brussels sprout. And around this time, I also heard Georgia Ede give a talk on YouTube talking about the neurotoxicity of nightshades and the neurotoxic effects of plants. So this really piqued my interest because around that summer, my mom and I, who's also a carnivore now, my mom was doing the keto diet with me. We were in maintenance, and she grew a garden. And the entire garden was nightshades. And we were eating this because I thought, well, I'm in keto maintenance and I feel good. So we were eating tomatoes, eggplants, peppers. And both of us that summer had massive back flares. And this was after a period of being pain-free for a long time. And I had come a long way in my recovery. I was feeling really good. My foot drop was resolving. I had lost some weight. My legs were the same size. My muscle imbalances were beginning to correct themselves. And I listened to this, and I immediately called my mom, and I'm like, Mom, I think the garden is killing us. We call it the summer of the nightshades. So we started looking into the carnivore diet and omitting plants. And after doing some research, I felt comfortable enough that I felt I don't need a vegetable. I'm just going to go for it. At first, I failed because I wasn't eating enough. And being a tracker, I was nervous that, well, if I eat too much protein, am I going to go out of ketosis? And, it's very important that I stay in ketosis. So I ended up eating to satiety, but I always made sure I was adding fats in so that I could get the fats, because the protein and the fats and the cholesterol are the building blocks for the nerves. So it was very important that I was feeding the building blocks that for my body to be healing, the proteins to be able to build the muscle in my leg, make sure I was getting enough of that. And when I did test, I was comfortable enough to see that I was still in ketosis. So I stopped tracking and I just kind of listened to my body's cues as far as, eating the protein and fat. And it just became a natural ratio to me. I just figured out what worked for me. I stopped measuring how much I was eating, and ended up through the course of that just being on a natural intermittent fasting cycle based on the rhythm of my body, which ended up working out really, really well for me.
So what is that naturally for you?
Naturally, it's just eating one meal a day. I tend to eat one big meal a day that consists of steak and eggs, and I add in salmon roe. If I'm throughout the course of the day, I will have a cup of bone broth that I make homemade, so it's very gelatinous and loaded with all that good stuff. Occasionally, in place of eggs, I'll have wild caught salmon, but that's pretty much my meal. Sometimes I'll have eggs and bacon, but mostly I just eat the same foods over and over. So it's either going to be pasture eggs, sugar-free bacon. I'll have ground beef, or I'll have a steak, and then I do add on the salmon roe.
About how much meat would you say you eat per day?
I was eating 2 to 4 pounds a day, depending on my hunger, because depending on, my cycle, my menstrual cycle, I would be hungrier the second part of the month than I would the first. So I would give into my hunger and satiety signals, because I learned to really listen to my body. And if my body's hungry, I need to feed it what it needs.
So you can eat more than 2 pounds at one meal?
I can eat 2 pounds in one meal. During the second part of the month, I would sometimes break it up into 2 meals because I would get hungry a few hours later. But I could easily, because this is the meat prior to it being cooked. Once it's cooked, I'm not sure if it goes down in weight, but it's
just water.
Like to eat 2 pounds of ground beef once it's cooked up, that would satisfy me.
Yeah, I can definitely eat, I don't know, I have a hard time with 2 pounds in one meal, but but I can eat 2 meals with, 2 pounds, 1 pound each meal. But I think that's also just that's also just cultural conditioning. We're told not to stuff ourselves and all that kind of stuff. So it's so I don't know. I did it the other day. I ate 2 big steaks at one time because I was going to try to do OMAD, and then, but I think I just have a lot of baggage around fasting and all the restrictive dieting that I've done. And so it wasn't, the next day I felt more crazed about food and more, turned on all the alarm bells. And I was just like, okay, I don't know. I think I'd just better to do 2 meals and eat a pound at each meal, because that just makes me feel less restricted, But I've heard both ways, some people feel really good the way you're saying, and some people feel better the way I'm saying. So I don't think there's a right and wrong. You just have to listen to your body, right?
Yeah, I think it's just figuring out what works for you, because I know that there's a big debate with the protein and fat ratios. And in my own personal journey, I found doing the higher fat works for me. I get the best body composition. I feel the best. So my philosophy in my own training and in the way that I eat is I'm feeding myself the building blocks, which is the protein. So I'm getting adequate building blocks, but I also need the fuel. And because of my injury, I really need that fuel. So I don't want to shortchange myself on the fats and shortchange the fuel. Because if you're depriving yourself and not getting the adequate fuel, then your body cannot do what it needs to function as far as energy, as far as healing itself, and the cofactors and everything that goes into what goes on to keep our body in homeostasis can occur. So I feel it's a fine balance between the building blocks and the fuel, but don't shortchange yourself on the fuel. Now that I'm at my goal weight, because to get to my goal weight, I did go higher protein, lower fat, which I did get a good result. But to maintain that result, I had to switch it to go higher fat and a lower protein so that I'm able to maintain and give my body the fuel that it needs. Because at this point, I'm happy with my body composition. I really don't want to lose any more weight. I'm happy with how my training is going. I don't need to be stick thin. I could probably lose another, 10 pounds if I wanted to. But I really don't feel the need. So at this point, I've focused on feeding my body the fuel to be able to do what it needs to do.
So that for a period of time, you did a lower fat, higher protein, like you said, Naaman, and then now you switched back to like a Paul Saladino.
Yes,
like
because
50-50 kind of.
Yeah, I did. I was doing a 2-to-1 protein to fat because I was doing some of the carnivore shredding programs at the beginning of the year because I wanted to see, well, would my body respond to this? Because I was really interested at that point in training techniques because I've built myself up to the point where I've had what I consider a full recovery of my motor and sensory. I feel really strong. And I was focusing on training techniques in the gym to optimize and keep my muscle imbalances in place, but also to just build some more strength and build some more endurance. So I was challenging myself. And I thought, well, let me see what I can do with body composition because I follow all these people in fitness, and I kind of wanted to see, what I could achieve personally. So some of the carnivore shredding programs recommended going higher protein. So I did, and it got me down to my lowest weight, but I found it was not sustainable for me. And I started not feeling well.
Practical. So like, what does that mean in like practical terms? Like a higher protein, what would that look like?
I was eating a lot more meat than what I was eating initially, like pounds of meat. And because I wasn't getting my fat source, to the capacity that I was eating the fat, I was just hungry all the time. So I was just eating, and wasn't eating OMAD. I was just eating whenever I was hungry. So I was eating more protein. And I did get a good result with the body composition as far as my muscles popping and leaning out. So I went down to my lowest weight, which was 127 pounds. But that was not sustainable to me to be eating that much protein and to be that hungry all the time.
Like 90% ground beef, or how did you achieve that?
I did leaner cuts of meat. I did like leaner cuts of meat more often. So the fattier cuts of meat, I wouldn't eat all of the fat that was on the meat. I would go for the leaner, the grass-fed, grass-finished. I stopped adding tallow, which I normally cook in. So I noticed I got the result, but it wasn't sustainable in the fact that I started to feel tired and I was hungry and I just was not feeling well. I was kind of low on energy, and I realized that I was shortchanging my fuel, and because protein's not a fuel, it's a building block. So I needed to start adding back in the fat. So once I got the result and I was happy with how my body looked, at that point, it wasn't worth it to continue in something that wasn't sustainable for me. So I switched it back to adding the fats and lowering my protein, going back to the fattier cuts of the meat, adding in my tallow. And I've been able to sustain my result. And I feel better. So I think if you're trying to, lean out, that you could go that way. I mean, it worked for me personally. I know the macro ratios work different for different people, but in my experience, it was not sustainable for me past the 2 months that I did it.
Okay, 2 months. That was what I wanted to know. So you did it about 2 months. And
Mhm.
so who were you following at that point to try to figure this out?
I was following two different carnivore shredding programs, the Danny Vega one and also the William Shufel. So I learned from them because I follow both of their accounts. So I wanted to see, well, what works for me in my case. I think with the neurological injury, it's really important that you go higher fat. I think it just an observation, and I'm not an expert by any means. This is in my own personal experience and also in transformations and N=1 stories that I follow in the keto and carnivore space. The patients having the best results are the ones that are the higher fat diets. And then there was also, I saw an interview with Dr. Clemens from the Paleo Medicina, who was speaking to the point that most patients with epilepsy, I think it was only 1 out of 10 that had a result on a traditional ketogenic diet with having an impact on seizure activity, where patients that went to the higher fat paleo, the PKD, ended up having slightly better results. So I feel that there is definitely something to be said going higher fat with a neurological injury.
Absolutely. I mean, I think I've done lean, chicken breasts for years. So I think that would make anybody crazy after a little while. And I mean, also there's like vitamin A deficiency and all that kind of stuff that you run into if you do low fat for too long. But probably for a little bit, it's not too bad, I guess. I know Sally Fallon, for example, does not like that. Like protein powders and things without fat, or can really cause imbalances. So just like, I mean, I know your story's more about the recovery and all that, but just like so people know, like where were you weight-wise, kind of like when you had your injury, and then like kind of like give us a progression of what, just to kind of sum it up.
Oh, sure. So I was at my heaviest, I was around 220 pounds. Then I lost the 50 pounds, and then I had lost some more weight. So I was around, I want to say 166, 165 around the time of my injury. And then my injury was now 3.5 years ago. And at this point, I'm at my lowest weight. I actually weighed myself, so I would know my weight for this. I was 128.5 pounds this morning. So I didn't realize how much weight I had lost over this entire journey until Sean Baker pointed out on HPO. So it's been, I calculated around 92 pounds is what I've lost, because I was so concerned about walking again, and I was so concerned about correcting my PCOS that the weight was almost a secondary thought to me. And then the best part of this whole journey was I went for a checkup at my OBGYN, and they did an ultrasound because I just wanted to see what the state of my PCOS was, because I hadn't thought about it because I was so concerned about walking again, and there was not one cyst on my ovary. So it reversed the PCOS symptoms that I was having. I noticed I had a regular menstrual cycle at that point. The cosmetic issues that I was having with the discolored skin, the skin tags, the hirsutism, all that kind of resolved itself. So I was having, I ended up getting a great result, but it was something I wasn't noticing or paying attention to because I was so concerned with walking again that I didn't even notice that the PCOS symptoms were clearing up. My hair is the thickest it's ever been. My skin is the best it's ever been. I'm a person that's had chronic eczema my whole life. I have not had an eczema patch, and I can't even tell you how long. So all these symptoms have resolved themselves, and I believe part of it is that I just had a leaky gut too because of what I was eating, because I noticed all of my GI problems because I had problems with the irritable bowel. And then after my surgery, I struggled with constipation, which I thought was a side effect of my back surgery and my injury, which I'm relieved now that that's completely resolved itself. And I've concluded that that was my diet and not a result of my neurological injury. So that was a relief for me to make that observation within myself too.
So now you're saying, so how is your digestion now?
I have no problems. I have no abdominal pain. I have no bloating. My stomach is flat. I go to the bathroom like a normal person, which is a relief after everything I've been through. So I honestly have no problems. I'm turning 42 in 2 weeks, and this is the best I've ever felt in my life.
It's amazing. So how often do you go number 2?
Oh, every day. Every day. But so everyone always asks me this question, like, how do you go to the bathroom eating all meat? And you have a normal bowel movement. It may not be as much because if you're taking in more food, you're going to go more often. And depending on how that food is absorbed, is going to depend on how much bulk you have in your stool. So if you're eating a solely meat and fat-based diet, that's highly absorbed in the small intestine. So you're going to make less stool, but you're still going to go. And completely eliminating fiber, I have not had any problems at all with constipation. Prior to that, the year after my back surgery, I was eating fiber because I was following a ketogenic diet. And then prior to that, I was eating paleo. So I was having a lot of problems, which I think a lot of people do when they're eating that amount of fiber content that's not being absorbed.
Yeah, well, and I mean, if you're eating nuts and seeds plus vegetables and salads and flax seeds, and I mean, it just goes on and on of what you could eat on paleo or keto.
Yeah.
That people think is going to make them regular, but it really makes everything worse. And I think we're just also conditioned to have these giant poops, like, but doesn't mean that's normal, for ancestrally.
I really, when I really stopped to think about it, and after listening to a lot of the experts in the keto and carnivore space and listening to a lot of scientific talks, a lot of what our guidelines and what we think is the correct thing to do is actually not based in scientific evidence. It was just based on the opinions of a few people that made an observation. But the observation was never tested. And then when science was actually showing the opposite of that observation, because we have been so socially conditioned, such as with fiber and salt, all these medical fairy tales have kind of come into society, and we've heard it so often that we repeat it as if it's a fact, when in fact it's never really been studied in the literature, and what has been studied has shown the opposite of that. So it's almost as if we need to have a re-education of medical education and providers, and also to help patients, because this has become a barrier in people changing their nutrition. And it's there's the fear of saturated fat, there's the fear of salt, there's the fear of not having fiber. So a lot of patients that end up having a really good result on a ketogenic diet or a carnivore diet and go into their doctor and they're feeling great, they're losing weight, and then a blood test comes back, such as an elevated cholesterol at the beginning of a ketogenic diet, and the patient spirals because then there's confusion, lack of confidence. Am I doing the right thing? So I think where everything's going in the ketogenic and carnivore space right now, with the education and the scientific information that's coming out from leading scientists and experts, I hope that paves the way to empower patients in looking at the ketogenic and carnivore diet as an option in treatment of their metabolic conditions, and possibly a cure or remission for a lot of these conditions.
Don't say cure. So is it hard for you, like, in your mind, because you had this miraculous intervention from conventional medicine, but also you've had this recovery from ancestral dieting and carnivore approach, is it hard for your brain to put those two together and like, make them work together?
At first it was, because I was classically trained in I was a nurse prior to becoming a pharmacist, so I was classically trained in the standard of care and American medicine and the nutrition guidelines. So that's what I went by, and that's what I used to try to reverse my polycystic ovarian syndrome. Once I started really empowering myself and speaking with patients and people that follow the ketogenic diet and really looking at case reports and following transformations, and what I know now compared to what I knew 10 years ago, I do have confidence that the science supports the way that I am personally eating, and I'm comfortable recommending this as an option to patients that are looking for another option outside of medicine, taking daily medications, or if their condition is worsening and they're not getting the result that they're looking for. There's a lot of practitioners that have come out that will help patients with the ketogenic diet as an option. So I'm grateful that the conversation has started. What I tell my patients is I'm here to support you in whatever capacity. That's based on your individual decisions and how you want to manage your health. So some patients are not open to a nutritional lifestyle change. They'd rather take a medication. My responsibility is to make sure that they're empowered and understanding everything about the medication that they're putting in their body and that they're doing it safely and correctly. That's a person's individual choice. I don't hold any judgment for whatever that choice tends to be. I don't push the ketogenic or carnivore diet on people. But I do offer it as a suggestion for patients that ask me what more could I be doing. One of the things in nursing school that I was taught was the first thing you teach a patient is lifestyle interventions, exercise, nutrition. So based on what's coming out in the science, especially about plant lectins and everything that we're learning, I definitely do mention this as a possible root cause or an option for patients to correct, whether they're struggling with depression and anxiety, whether they're struggling with excess weight, especially patients with PCOS that don't want to be on metformin and don't want to develop diabetes. This may be an option because PCOS is rooted in insulin resistance. So if we can control our insulin resistance through some of the options and solutions that have come out, such as intermittent fasting and going on a lower carb diet, why not try it and see if you get a result, especially if nothing else is working. I also let patients know that there's a safe way to do a ketogenic diet, and it's very important to have a good relationship with your doctor. I'm not anti-doctor. I'm not anti standard of care. There's a lot of really good practitioners out there that want the best for their patients. So I encourage patients to be open with their physicians if they are trying this, especially if they're on medications for their heart, for blood pressure, for diabetes, because these medications will have to be managed and titrated down so that the patient is safe while they're doing a ketogenic diet. And hopefully the end result is to get off medication and put their metabolic condition into remission.
Yeah, I mean, you don't want somebody to just who's taking a medication to, because it can change so quickly. I mean, I had that happen to one of my family members. I think it was her blood pressure medicine or something. She was like fainting or something, because she was having so much success. I think she was doing paleo at the time, but she was not needing it. So it was making her like faint. And so it's like, you can't just keep doing the same thing. You have to stay monitored when you're taking some kind of medication, right?
Absolutely. Because when your insulin lowers, your insulin holds on to water and the salt. So when your insulin lowers, you're going to have a release of water and salt. So it's going to naturally lower your volume, your fluid volume. So it's important to salt and keep yourself hydrated. And then as you gradually unprocess your diet, you're not having fructose anymore, which has been proposed as a root cause mechanism for high blood pressure, because it affects factors that dilate and constrict the vessels. So your blood pressure is going to be affected. So there is a safe way to institute unprocessing your diet. And I highly, highly encourage people to let their doctor know that this is something that they want to try, so the doctor can monitor their medications. Because the most important thing to me is that people are safe in doing this, and that they're doing a keto or carnivore diet correctly, and that they're safe with their medications.
So, speaking of electrolytes, I mean, this summer has been a lot more challenging for me with electrolytes. How do you manage that for yourself?
Personally, what I do is I use, I love Redmond salt. It's the best tasting salt I've ever had. So I heavily salt my steaks. I salt to taste. If I have a salt craving, I will just put some salt right on my hand and I will eat the salt. So I carry it with me all the time. I'm a person that drinks anywhere from 2 to 4 liters of water a day. I like to keep myself hydrated because it's important for my back. I do, as far as magnesium, I do an Epsom salt bath, usually every other day, because it's absorbed through the skin. I find it helps with, because I still do have a little bit of muscle spasticity. Sometimes I'll get some cramping in my legs, and I don't believe that that's due to a deficiency in electrolytes as much as it's my injury having a little flare. So I find the Epsom salt baths really help me with that. And then I also use essential oils, which I've used to manage. I have an area in my right leg that cramps all the time, and it's due to my injury. So I use a essential oil concoction that helps relax the muscles. And that I also use to manage that. So I find for as far as electrolytes, I feel like I get everything I need in the food, and I do salt, and then I do the Epsom salt baths.
I have to take more salt in addition to my food, or else, I mean, because here it's like 100 degrees. So
yeah,
you can't just go outside like all morning and think, oh, I'm fine. Like, no, you're not. It's going to be a mess. So you have to kind of preemptively take salts or take it after. And also I found that a big thing with sleep. I was waking up like 5 o'clock in the morning every day, which is really annoying because I don't have to. And so I was like, so I started taking a teaspoon of salt before bed, and now I'm able to sleep till like 6:30 or 7.
Mm-hmm.
You know, it's like, now this is much better. So
yeah, I definitely think, because salt is needed for everything. We're basically oceans, so it's used for all the ion channels in our body and in our cells. So having an appropriate salt balance is, so critical. When sodium goes below a critical level, you're at risk for seizures. I used to see this all the time in patients that would be admitted to the neuro floor I worked on when I was a nurse, and they would have a sodium level that I couldn't believe. It was like so below normal, and they'd be seizing. So low sodium is no joke. So it's really important to keep the sodium levels up. There's a great book written by a fellow pharmacist called The Salt Fix. I highly recommend people read that book because it dispels a lot of myths about salt. It was very well written and well researched. So I highly recommend that book. I am very nervous, and I know this is probably going to be very unpopular in the keto and carnivore community, but I am very nervous about supplements for people because in my mind, supplements are drugs. It's just we don't think of them as drugs. A lot of them have the same excipients that are in prescription drugs, and have similar mechanisms of release. So they can disrupt your gut and affect the permeability. And that's one of the reasons that the Paleomedicina group do not advocate supplements, especially when you're healing up your gut. And I believe that could be a root cause in some patients that have autoimmune disease but are not getting the effect of the ketogenic diet in healing up their gut, they're still having symptoms, is eating a combination of possibly some of the high oxalate foods, some of the high fiber foods on the keto diet, and then also the vast amount of supplements
What kind of supplements
that we're taking
are problematic. I mean, do you like the ones you hear about the most?
I would say any supplement, because especially in the pill form, so it's, depending on the release mechanism of the supplements, the powders, because those are still chemicals. And with the book that just came out called Bottle of Lies, where they exposed the mass fraud in the generic drug trade, the supplements are highly unregulated. There's recalls for them all the time. There's case reports of patient deaths from them. There's contamination. It's not
even what they say on the bottle.
Yeah.
I mean, you have to pick your brand very carefully and don't just buy what's at Walgreens or whatever,
Yeah. There are some brands that have the USP seal, and by getting the USP seal means that they have committed to following good manufacturing practices, and what's in each supplement tablet or gel cap is what's in each capsule. So I tend to, for patients that want to take supplements, I'm like, watch for the USP seal that's on there, and just make sure it's a really high-end quality product. But a lot of these powders, I'm just so nervous for people taking, especially with neurodegenerative conditions and patients with autoimmunity, especially because they do disrupt the gut.
When you look at the ingredients, I mean, if you're trying to heal with a carnivore diet, but then you're taking rice powder or all these things in it that you see, like cellulose or whatever crazy stuff they put in it, it's like, well, but I do think that if somebody, I think after about a month or two of carnivore, they're probably not going to need much that they thought they did need. So I mean, it might kind of resolve itself, like, oh, I think I need all this, but really, like, I feel like it's naturally gonna go down if they stick with it. They're gonna stay.
Yeah, I definitely believe in functional supplementation. If you have a true deficiency and you need the supplementation as a bridge, especially for patients, for example, that aren't making the stomach acid. I know that they do have supplements for that. I know Isabella Wentz, who's the thyroid pharmacist, has a little supplement line to help patients that have thyroid disorders. But I feel like as you transition over into a whole food-based diet and your gut is healing up, you can transition off of those supplements because you're getting all the nutrients right in the food. So I just get very nervous for people with the supplements because we tend to think, oh, they're supplements, they're safe, but they're not all safe. They can be doing damage to you, and they may be doing more harm than optimizing you. So I do caution people as far as the supplements. Again, I respect everyone's choice for doing what's best for them, but it's something that I feel a lot of people don't think about as a possible root cause for why they're not getting the effect that they're looking for on a keto or carnivore diet.
So, I mean, on that same kind of wavelength, do you think that people can run into deficiencies with carnivore diet?
I haven't really seen, and not to say that this doesn't happen because I'm not an expert on this, and I know Dr. Saladino has talked a lot about optimizing nutrition, doing a nose to tail approach, where he's worried about certain nutritional deficiencies. The blood work that I've had, the blood work that my mom has had, and a lot of the people I follow in the space, the nutritional deficiencies aren't really being seen. So I think it's unknown at this point. So I think it's something that as more and more people do the carnivore diet for longer periods of time, that will reveal itself. And I think that Dr. Saladino has made some valid points and things that we can be watching for. Personally, since I've been following him, I added in the salmon roe, and I do add in, I actually do liver. I have my butcher slice it really thin and I dice it up and we'll put it in some eggs. So I am incorporating that in based on some of the talks that he's given and the rationale behind that. So I thought, well, that makes sense. It won't, won't harm me. But
on bones?
I'm sorry?
You're not gnawing on bones or bone meal or whatever?
No, because that's a supplement. So I'm very nervous, especially in the injury I had. I'm very nervous taking anything that's not, from a whole food source that I get in my butcher shop or that I get through one of the meat companies that I order from.
What about collagen or gelatin?
I feel
supplement.
I feel like I get enough of that just right in the bone broth and right in the egg yolks.
Do you do coffee?
I do coffee. That is an addiction I've had since pharmacy school. I have tried, and I do, when I do coffee, I have one a day, and I've actually been having 2 a day because I've been doing the 7-day fast with Jimmy Moore and Chris Donahue. But I tend to have it black. I have one in the morning, or I'll tend to have it black with like a teaspoon of ghee, and I blend it up. And that to me is delicious. It gets my morning going. I like to have it before my workout. And I feel good. So I'm not someone that needs to be having coffee all day long. Actually, if you have coffee, there's a chemical that it can actually interfere with and can affect your restorative sleep, which is adenosine. And the caffeine competes for the receptors. So if you're drinking coffee too late in the afternoon, you can actually impact your body's ability to fall asleep. So it's a mechanism that works separate from the melatonin. So it's almost like 2 separate operating systems, but it's an important system for sleep. So if you're not, if you're drinking coffee too late in the day, your body's call to fall asleep and chemical that will help you fall asleep, it's not there. So you'll end up having a disrupted sleep, and you'll be shortchanging yourself on the first part of the sleep, which is the restorative.
Yeah, I mean, I only drink decaf, so that's what a wussy I am. But and I mean, I like everything you're saying about sleep, because I think people want to make it so complicated, and I know sleep for me was huge with my recovery from Hashimoto's and my adrenal fatigue and all that kind of stuff. So I like that because I feel like that was like one of the biggest things that helped me, was sleeping better and more, and not feeling guilty about it either,
Yeah, you can. And I think it's such an important part. It's like we're so conditioned, like we have to constantly be on the grind and constantly hustle, but we're shortchanging ourselves. Sleep is there to restore us, to heal us. And it's one of the most important things you can do. I make it a point to go to bed to get 7 to 8 hours of sleep. I have blackout shades. About a few hours before I go to bed, I'm off all devices. I actually take that time to read a book or talk to people or spend time with people I love and research. It's part of my sleep hygiene, and it's just so much part of my lifestyle that when I don't get the sleep, my body does feel it. But I think it's important for making the hormones that you need to restore yourself.
Absolutely. I mean, it's just so important. And I think people who say that have probably never been like chronically ill or something, because people who say you don't need sleep, it's like, well, you don't know what you're saying because you've never been really sick. So,
yes, absolutely. And when you are, your body has cues. So when you think about it, when you're not feeling good, what are the 2 things? You're exhausted and you're not hungry. So the body wants you to fast, and the body wants you to sleep, because that's how it's going to heal itself. So the immune system can do what it needs to do.
That's so interesting. Well, my computer's about to die, so let's just give people some encouragement. Maybe if their health is not where they want it to be, and give them some, final words, and then tell them where they can find more about you.
Absolutely. So I encourage everybody to empower yourself with information from the best resources that are available. Just go right to the top. And to truly make a change in life, just start choosing differently. And that's where the confidence is built in just making different choices. And if something's not working for you, try something different. Take action every day, just small little micro steps. Transformation is not overnight, so be patient with yourself. You're not going to be perfect, and that's okay. Just take your time with it. And where I can be found is my main platform is the Paleo Pharmacist on Instagram. I also have a podcast with Chris Donahue, the Mind Body Breakthroughs, and we run a free Facebook group, which is based on mindset, where we do monthly challenges. The July challenge is in minimalism, because part of health is not just physical health, it's also spiritual, emotional, physical health, financial health, environmental health, everything that goes into having a breakthrough and a transformation. In that group, we also put the top health resources, so patients have the top where they can go and see the latest science and make empowered decisions for themselves. I also have a website that I'm still in the process of refurbishing, which has been a labor of love, and that's at thepaleopharmacist.com.
Well, awesome. Awesome, Nevada. Thank you so much for your time today. And I know this is going to help a lot of people, and your very inspiring story. Thanks for sharing with us.
Thank you so much.
Keep in touch. Talk to you soon.
You too. Bye.